Hello everyone, we are Group 16 and our topic is LGBTQ sexual health. Our target behavior is sexual health of LGBTQ individuals, and the reason we chose this behavior in particular is because there are at least 8 million LGBTQ individuals in the United States. Since the 1990s, the rates of unsafe sex amongst these individuals has increased, which is also connected to the increase in sexually transmitted diseases and infections as well as HIV. Due to these facts, we believe that this target behavior in this population is important because practicing safe sex is important and it can prevent infections and diseases. The first theory that we used was the McGuire's 5 inputs. Our source is LGBTQ and U, which is our group. Our message is to practice safe sex by using a condom and other barrier method. Our channel is Instagram, and secondly, a flyer that we made. The receiver is LGBTQ individuals who are sexually active amongst the ages of 16 to 24 years old. And the destination is to increase the number of LGBTQ individuals practicing safe sex, which will then decrease the number of LGBTQ individuals contracting sexually transmitted diseases and sexually transmitted infections, which will then increase the number of people getting tested for these diseases and infections as well.
So for our intervention, we believe that the health belief model is the best theory in order to implement our intervention properly. With the perceived susceptibility, severity, benefits, and barriers, we believe that we are able to get people to go to action, and we're going to prime our population by walking them through and how to create a practical, positive daily lifestyle changes through our several channels of outreach, and we believe we can do that best through the health belief model. And so with that being said, our target audience would be sexually active LGBTQ individuals between the ages of 16 and 24. Our secondary audience being heterosexual individuals within that same age range who are sexually active. Now, we want to segment based on the fact of them being LGBTQ individuals in that age range and sexually active in San Diego. How we're going to do this is basically going to be finding journals and resources that are reputable sites such as the CDC and showing statistics that this population is at more risk for STDs and STIs than that of heterosexual individuals. So a perfect example would be that in 2013, the rate of reported cases of syphilis, 5.3 of those cases per 100,000 people, with men accounting for 91% of all these cases, gay and bisexual men accounting for the majority of these cases. In order to personify our audience, we have someone like Jacob, a 20-year-old student who identifies as a homosexual cisgender male. Jacob is active on all social media platforms, but mostly uses Instagram and frequently watches YouTube. He uses social media as a means to keep up with what is happening in the world, as well as popular culture, but primarily to stay connected with the gay community. Jacob is sexually active and frequently uses apps such as Grindr and Tinder in order to meet guys for both dates and hookups. He rarely uses a condom when having sex, inconsistently gets tested for sexually transmitted disease or infections, and never thinks to ask his various partners of their sexual histories. With a full-time school schedule, extracurricular activities, and a part-time job, Jacob is very busy and uses that as an excuse not to take time to educate himself or to seek out the proper services to ensure sexually healthy behaviors or practices.
Continuing on with our personas, our targeted secondary audience includes people like Kimberly, a 22-year-old bartender in downtown San Diego who identifies herself as a heterosexual female within her community, and she's very active on social media platforms like Instagram, Facebook, Tinder, and she uses them for not only her own pleasure, but also to promote her work as a bartender. Kimberly is also sexually active. However, she does not always use a condom when having sex. Why did we choose LGBTQ as our target audience? Well, according to the CDC, STDs have been rising among gay and bisexual men, with increases in syphilis being seen across the country. In 2014, gay, bisexual, and other men who have sex with men account for 83% of primary and secondary syphilis cases in the United States. Gay, bisexual, and other men who have sex with men are often very susceptible to get other STDs, including chlamydia and gonorrhea infections. All sexually active gay, bisexual, and other men who have sex with men should be tested regularly for STDs.
So our channel we decided to use is social media, and specifically Instagram. We've created an Instagram page with the username LGBTQNUSD, where we have started to post about the education, promotion, and support of LGBTQ health within San Diego community. Posts will include content about STD education because that's what we are specifically targeting within the community, as well as testing, support groups, counseling, as well as other resources such as the LGBTQ Resource Center on SDSU's campus. Here on the right is a screenshot of our page we have created. Diving into our Instagram, here are a couple of screenshots of some of the posts we have done already. We wanted to create a fun and welcoming vibe, so we thought it'd be cool to post fun pictures attached with captions that are informative to motivate our followers to stay sexually healthy. Our second channel we decided to utilize was a flyer, which is right here on the right side. We plan to post this flyer around San Diego County, maybe downtown in restaurants, coffee shops, medical offices, on bulletins, but most importantly, Hillcrest, where there's a vast amount of LGBTQ individuals living there.
In order to collect data, we would perform qualitative research in which we would conduct an interview and a focus group. We would recruit a diverse sample of 16 to 24-year-olds who identify as members of the LGBTQ community because this is the specific population that we are targeting. We would use this type of qualitative research for our evaluation because open interviews is the easiest way to collect highest quality of data in regards to the topic that we are focusing on, which is mental and sexual health in the LGBTQ community. It allows us to dive into the specific issues affecting someone who identifies in our target population and therefore improves the tailoring and the efficacy of our intervention as we collect primary data. We decided to use this type of qualitative research for our evaluation because we would be able to collect various points of views for our data since it would be a collection of various answers. Focus groups show how these two topics adversely affect different parts and perspectives of the community. Sexual and mental health are intersectional issues that demand a deeper look into the root causes of health disparities, and focus groups will allow us to do this. Some of our example questions we would ask would be, how would you define safe sex? How extensive was the education curriculum you experienced in school growing up? And what obstacles do you face in regards to seeking out the resources for your sexual health?
Our first message really aims to engage our audience through the central root. We want the statistics on the higher risk for LGBTQ+ individuals to contract an STI, especially when not using a condom, to speak for itself. We believe the data will serve to advise and activate the motivation to use condoms as an integral aspect of their sexual behaviors. Guided by the light model and set in place by a loss-framed narrative, we are confident the statistical logic will reveal the negative outcomes one will experience if behavior in regards to condom use is not changed, and therefore will serve as a catalyst for a safer sex practice. Our second message, love is love, just use a glove, takes more of a peripheral approach in influencing the audience. The image and rhyme serve as the argument, and it does not take much critical thought to engage with our argument. Love is love is a very popular mantra adopted by the LGBTQ community in pursuit of equal rights, and so the familiarity of this message will serve as an effective heat or emotional appeal. This message advocates for the intended audience as well as activates them to increase condom use. Our loss-framed structure of no glove, no love will motivate our audience to change their sexual behaviors because everybody really does want love.
Our overall impact was to increase the number of people getting tested for STD and STIs in San Diego by 15% within the next year. We felt this was a good place to start and then hopefully continue to expand from there year after year. And the impact evaluation measure was to survey the number of people who have recently gotten tested for these STIs and STDs, both before and after the intervention was put into place. Our outcome goal is the opposite of the impact goal. So instead of increasing the number of people, we want to decrease the number of people who have STIs and STDs in San Diego by 15% within the next year. And our outcome evaluation measure is we want the prevalence of people who are diagnosed with an STD in that timeline of 1 year. To wrap it all up, there are over 8 million self-identifying LGBTQ individuals within this country, and there are not enough adequate and available health resources and services for these communities, so we want to prioritize and advocate for this marginalized group. Those of the sexual and/or gender minority status do not make up a significant amount of the population, but are disproportionately affected by sexual transmitted diseases and infections. and we hope to use our hashtag LGBTQ and you to provide, educate, and aid in the movement to better the lives of LGBTQ individuals here in San Diego.